and I'm here from the Winnipeg Regional Health Authority to tell you about a very rewarding career. Professional mental patient. Now, before I begin, just a little bit about myself, your presenter today. See those letters after my name? No, not my university degrees. No, those three letters, PMP, they stand for, you guessed it, Professional Mental Patient. It's my professional designation, a certification I've earned by being, well, certified. And certified, and certified. In fact, my portfolio is all over town. They call it my medical records, but it's all there. And I just want you to know this because the Winnipeg Regional Health Authority would not send a non-professional to talk to you. This is not some fly-by-night presentation. This is the real deal. So, to kick things off, the obvious question. What makes a mental patient a professional? Now, there's lots of ways of thinking about this problem, but let's stick to fundamentals. Basically, what makes anybody a professional? Well, professionals get paid for what they do, and amateurs, on the other hand, don't. So when you're thinking about entering this profession, I think you should ask yourself the question, is this a job or is it a hobby? So what does it take to become a professional? Well, I've created this handy-dandy slide to compare the differences between professional mental patients and amateur mental patients. First of all, professional mental patients have a lot more experience in the main work site of psychiatry, the psych ward. We're talking 10 to 60 or more hospitalizations in a lifetime, one every year or two, sometimes more frequently. Amateurs, on the other hand, may never see the inside of a hospital, or maybe once or twice, 3 or 4 times maximum, with like decades in between. So big difference there. And to get a picture of this difference in experience, I want you to imagine if you were hiring a plumber. Who would you pick? The guy that's seen the inside of like 1 or 2 sinks in his lifetime? Or that fellow who had his sleeves rolled up day in, day out in sinks, toilets, bathtubs, everywhere? Well, I know who I prefer. Next, there's a difference in how professionals and amateurs process medications. So basically, for professional mental patients, medications make us feel terrible. And that makes sense, because after all, if they made us feel good, we would be tempted to pay you, not the other way around. And that's just not how it works. Amateurs, on the other hand, have been known to say things like, I love my meds, and my meds make me functional. Then there's a matter of language. There are special reserved titles just for professionals. Terms like the mentally ill, capital M, capital I, revolving-door patient, low functioning, and psychotic. That one's my favorite, personally. On the other hand, amateur patients, no special language. People, sad, scared, and employed. Finally, there's a difference in talents and skill set. So professional mental patients have highly developed dramatic skills. So we can talk really fast, we can free associate with the best of them. Our minds and bodies are meant for nimble, unbounded expression of imagination and feeling. Here's the big test. By being basically, can you be so fascinating, compelling, and socially inappropriate in public that someone calls 911? If so, well, you're on your way. Otherwise, just keep working on it. Amateurs, on the other hand, they're too shy to really develop these dramatic talents and let them shine. So they like to stick to safe expressions, like crying and screaming. And they do those behind closed doors. Well, that's not the way to get ahead in this particular field. So now that I've given you the criteria, I'm sure you're thinking to yourself, my goodness, it looks very, very hard to become a professional mental patient. And I could see how it would appear pretty daunting at first, but I have some good news for you. First of all, there's a point system. So if you don't meet all 4 criteria, but you meet, like, say, 3 or even possibly 2, there's a chance you'll get chosen. Also, for those of you who are currently amateur patients and you're thinking about your vocational future, I just want you to know that you could be just one big breakdown away from becoming a professional. And finally, for those of you who haven't been diagnosed yet, well, don't despair, because 1 in 4 of you will receive a psychiatric diagnosis in your lifetime, and that is the first step towards qualifying. So now that we understand how you become one, let's discuss the numerous benefits of becoming a professional mental patient, starting with our contributions to society. And first of all, we are excellent job creators. Move over, entrepreneurs. Professional mental patients create jobs for all these people, and these are great jobs with great benefits, lots of good salaries. So I want you to consider, if we did not exist, what would happen to those poor psychiatrists and nurses? Well, they might lose their nice homes and vacations. We can't let that happen. Next. We are a wonderful cause for our families, ennobling everyone who has to take care of us or help take care of us. And as everybody knows, the most important thing is that our poor, suffering families come out looking good, no matter how we actually feel. Also, we give them lots of exercise, running around town looking for resources that don't exist. And finally, professional mental patients are a tremendous source of art. So no matter what your medium is, whether it's popsicle sticks, collages from women's magazines, painting dollar store kitsch, I'm pretty sure there's a day program or drop-in center for you. But remember, it's important to add affirmative words to your art, words like love and peace and happiness, in the hopes that you will actually feel those things one day. And no mental patient art is complete without at least one misspelled prayer. So that's the benefits to us. I mean, sorry, not to us, to society. But what's in it for us? Good question. And we don't usually talk about this. Usually the Winnipeg Regional Health Authority likes to sort of keep it a closely guarded secret, the goodies that it reserves for its patient employees. But I just thought, since it's such a sweet deal, I had to share it with you today, because Google has nothing on us. So, I'd like you to come with me on a little journey and imagine a cozy old hospital, white tile floors, fluorescent lights, and the fortress of the nursing station, with a nurse so polite that she doesn't even talk to you as you walk by. And off a ways, there is the day room with a television set and puzzles, many puzzles, only missing a few pieces, and a nice collection of used books, encyclopedias from the 70s, Reader's Digest condensed novels, the Bible, and coloring sheets galore. Not that you can really focus on any of this because you're so over-medicated, but it sure looks good. Then across the way, another lounge with 2 exercise machines, only slightly broken, and a foosball table with no foosball. Remind your family to bring a ping pong ball the next time you visit. Then down the hall, there's a computer with an old little square monitor, no office products, no games, leaving you to scratch your head until you're like, oh, it has a web browser so I can see YouTube. Then by the nursing station, a phone against the wall with a 10-minute limit to teach you courtesy. Then there's the WRHA's excellent counseling program. Oh, just kidding. That's what the other patients are there for. But they do help you with that impulse control, because in the kitchens, the fridge has a lock on the door, That way you don't eat the entire hospital if you're taking an antipsychotic like Sept. Not that the weight gain from psychiatric drugs is bad. Like, look at me. Look at how fluffy and cuddly I am. Thanks to the enormous amount of weight I gained from Seroquel, I can now spend more time in bed cuddling because I've developed terrible foot problems. Well, those are some pretty cool benefits, eh? Okay. So, at this point in the presentation, I've been instructed to tell you about the hazards of being a professional mental patient. But before we begin, I just want you to know that none of this stuff is a big deal. Nothing you're about to see is the least bit traumatizing, okay? Right. Start the music. Unwanted police contact. Don't worry, she's not arresting him. She's just taking him in for an involuntary psychiatric assessment under the Manitoba Mental Health Act. Forced hospitalization. Yes, the doors are locked for your own safety, of course. Forced stripping and changing into hospital pajamas. Don't worry, it's only for a couple days until you get your privileges. And besides, your pajamas won't get stale. There's an endless supply in the laundry room. But pro tip, put the pants on backwards so your ass is showing, not your crotch. Forced medication, but you have a choice, pill or needle. Without the toilet. In this room, you can enjoy absolute staff neglect while sitting on a cold floor or bare mattress. And if they cover up the window with paper, you get that lovely feeling of, no one gives a crap about me, and I might be here forever. Pro tip number 2, urine is sterile, and if you pee yourself, they have to check on you. Feeling like a zombie.
Brains! Brains!
No, not that kind of zombie.
No, where are my brains? I can't think. I need my brains back.
Indefinite sentence, I mean terms. Don't worry, he's just renewing his involuntary status under the Manitoba Mental Health Act. No judicial involvement, just one doctor's signature. Efficient, isn't it? And finally, early death. Side effects of the drugs you will be taking include massive weight gain, hypertension, diabetes, heart disease, stroke, kidney failure, liver failure, and much, much more, leading to 10 to 25 years of reduced life expectancy, according to the World Health Organization. But who wants to be old anyway? Well, there you go. No big deal, like I said. Well, let's move on. Let's talk salary. I make $600 a month from Canada Pension Plan Disability, but if you don't mind living by yourself with no partner or spouse to take care of you, you can earn almost $1,000 from provincial welfare. And even better news, professional mental patients enjoy excellent job security. As long as you keep acting weird and they keep medicating you, you have a job for life. Well, thanks for coming out. This presentation was brought to you by my employer, my de facto employer, the Winnipeg Regional Health Authority, who won't give me a contract, won't let me quit, won't let me reduce my workplace hazards, won't pay me for my trauma therapy, and won't pay me a living wage for this 24/7 job. If you have any questions, here's my contact information. Well, this has been a pleasure, but I'm off to work now. There's an opening at St. Boniface Hospital. I must fill it.